So I remember um, when I had started my practice and I used to work at a charitable clinic, and there a very old woman once came and she complained of stomach pain, indigestion, constipation, and complaints like that. And she was very sort of angry, irritable, cranky. She was saying that I have this pain since so many days. It's been 15, 20 days I am having this pain. But my son is not taking care. He just keeps telling that I don't have time, I don't have this, that. He has time for other things in life, but he does not take care of me. And she was very extremely disappointed with her son and how he was not taking care of her. And while she was narrating this complaint, she was also, in a way, disappointed with me. And she was saying that you see, I am telling you so many symptoms. I am suffering so much. I have so much pain. I have this, and you don't even get up from your chair. You don't even examine me. Come, see, look, what is happening? What is happening to my stomach? So I said, okay, please lie down, let me examine you. So I examined her, and what happened is I examined her location of pain, which was in the right iliac fossa. And I, pressed the right iliac fossa. When I pressed, she was not in pain. But when I left it, then she shrieked with pain. And then she said, "Oh, it's very painful." So then I understood this is known as rebound tenderness. So when you press, there is no pain, but when you are releasing the pressure, the patient complains of pain, and this is very characteristic of appendicitis, and especially if it is a long continuing appendicitis. So I said, "You have appendicitis?" So she said, "Yes, yes, you see, nobody is taking care of me, etc." So, what I understood in this case is that this woman is firstly very extremely disappointed and feeling let down by her son. No? So, this is where, if you know the periodic table, and if you know in the periodic table, the third row of the periodic table has to do with desire for care, nourishment from others. They desire care and affection, nourishment from others, and they don't seem to get it from their family members. In this case, she does not get it from her son, and because of that, she is feeling very extremely disappointed. This disappointment is a theme of halogens. So, which halogen is there in the third row? If you look at it, the remedy there is chlorine, which in our homeopathic language or in our homeopathic materia medica, it is given in the form of muriaticums. So I knew something to with mure has to be given to this patient. And then I asked her about her indigestion, etc. So she said, my main complaint is my constipation. When I'm passing stool, I feel like, the stool is like coming out in pieces. It's just crumbling and coming out in pieces. So then I knew what is the remedy. The remedy that I gave her was magnesium mure. And if you open the materia medica, and this is from Allen's keynote, you see this is what it reads: especially adapted to diseases of women complicated with uterine disease who have suffered from years of attacks of indigestion or biliousness. So she had this indigestion, all this as a chronic complaint, but at present her main acute was because of this indigestion she has developed appendicitis. So looking at this complaints and also the stool, where is this constipation, if you see constipation, crumbling at the verge of the anus, this is very characteristic of sort of magnesium mure, and this sheep dung like stool where small pieces of stools come out when I am trying to pass my stool. Now, this description, along with this crumbling at the verge of anus and the third row features, I gave her magnesium mure, and after that, she felt much better, and she basically um, was completely cured of the appendicitis. She didn't undergo any operation. She completely recovered out of it, and obviously her disappointment towards her son also was less, and towards me also was less. She was obviously happy that I am better and I have improved. Mm, but also her attitude towards her husband, her son, was like, it's okay. He does not still take care of me, but okay, now he also has a life. He also has to earn. He also has to look after his family. But at least once a month, if he gets me here, I am happy. That much I expect, and that much he's doing. So now I am happy. So she was happy physically, mentally, emotionally. So that is what we can achieve by understanding the remedies in a deeper way. See, maybe I could have given her magnesium by looking at the magnesium muriaticum, by looking at the stools crumbling at the verge of anus. But this deeper understanding of care, affection, disappointment, this is what will give us the satisfaction that we can change a patient's life holistically. So this holistic improvement of the patient, where the mind, body, and the soul are are coming back with a very in a very rejuvenated manner, no vital revitalization of body. That is what we can say of body and mind. I'll say revitalization of body and mind. That is what um, we can achieve by learning these new techniques of the sensation method, periodic table, plant kingdoms, animal kingdoms, and so on and so forth. So that is what I wanted to share with you, friends, and I hope this mm, encourages you to learn more and give more deeper and holistic relief to your patients. So see you all soon in our next video. Till then, bye bye.